I'm Nurse Christine. You can find me located at the Inner Beltline location. I've been injecting for the past 8 years, and I've been part of the Synergy team for the last 2. Today, I'm going to talk to you a little bit about Botox. Botox is a neuromodulator. It's primarily used to relax the muscle, which would help to decrease and soften any fine lines and wrinkles. The best candidate for Botox is somebody that doesn't have a neuromuscular disease, not pregnant or breastfeeding, and is at least 18 years or older. The most common areas to treat with Botox are in between the brows, known as the glabella, the forehead, crow's feet around the eyes, the masseter muscle, the lines to the nose, we call those money lines, as well as around the mouth, which can do a lip flip, our DAO muscle, which is depressor angularis oris, our mentalis, as well as platysmal. You will receive a consultation, and during that consultation, we'll be able to address your areas of concerns, your goals, and the plan of care. We will discuss the standard amount of Botox that you will need to achieve your optimal result. The Botox will kick in within about 2 weeks, and it will last you 3 to 4 months. It is fairly painless. I use a very small needle during the process, and the only thing I ask afterwards is that you don't exercise for the next 24 hours or lay perfectly flat for 3 to 4 hours. It is not uncommon to get a little bit of bruising, so I ask that you avoid any kind of ibuprofens, aspirins, as well as alcohol for at least 24 hours before our treatment. As well as treating cosmetically, we can also treat medically to treat migraines, TMJ, as well as hyperhidrosis, which is excessive sweating under the arms, your palms, as well as the soles of your feet. And today I do have a live model. I've already completed a consultation with her, but I will go through and inject her and show you exactly what to expect during your treatment. So this is my patient, Alyssa. She is going to demonstrate along with me receiving Botox today. We've already had our consultation together, and she had addressed to me areas of concern, cosmetically as well as medically. One area of concern cosmetically is the line in between her brows when she squeezes her brows together. You can see that right there. The benefit of treating this muscle with Botox, once we relax it, it does lift the brows up very nicely. So for people that do have heavier lids or like that little lift, that is an excellent area to treat. Another area of concern that she had mentioned was the lines to her forehead. Go ahead and raise your brows all the way up. And she doesn't really have too much going on right now, but this will be certainly more for preventative. We will just sprinkle a little bit of Botox here for her as well. When we treat this muscle, it does pull in the opposite direction. So I do like to treat this muscle if we're treating this area here to prevent any heaviness to the brow. This muscle here will generally receive anywhere between 20 to 30 units. The muscle to the forehead receives anywhere between 8 and even up to 16 units, depending on the person's muscles. Another area of concern that she had expressed for preventative measures would be around her eyes. Go ahead and turn your head for me. Give a really big smile like the sun is in your eyes. And as you can see, she doesn't really have too much going on, so we'll just go ahead and sprinkle a little bit there, and it will also help to open her eye up. Another popular area that females tend to get is a lip flip. By injecting a couple units onto each side of her upper lip, it will go ahead and raise her lip up a little bit. That usually is anywhere between 4 and 6 units. The chin, if we were to treat her chin to relax it and to smooth out that area, that's also anywhere between 4 and 8 units. If she was to clench her jaw at night, something we call TMJ, or if she just wanted to angle her jaw a little bit better, if she felt her face was square, we would go ahead and inject the muscle called the masseter, and that is usually anywhere between 15 and 30 units per side. We have these bands in our neck, and as we get older, they tend to become more pronounced, and by injecting the bands in our necks, that will help to smooth out any necklines. Usually that's anywhere between 8 and 10 units per band. So for today, we are going to certainly treat in between her brows, a little bit to her forehead, as well as around her eyes. We're gonna give her a little bit of a lip flip. Medically, one of her concerns during our consultation was that she complains of migraines. She's had migraines as early as she could possibly remember. She's been followed by neurologists and on many medications, and it wasn't until she started to receive Botox that her migraines finally went away. So we are going to treat her in about 3 to 4 months. She will come back and receive another treatment just to ensure those migraines don't come back. All right, do you have any questions? No? Okay, let's get started. I'm gonna go ahead and clean off the areas that we are going to treat. A little bit of alcohol. As you see, we don't generally numb for this. It's fairly painless. I use an extremely small needle. The treatment itself usually will take anywhere between 5 and 15 minutes. So what I'm gonna do first is look at her symmetry. If you split us right down the center of our face, we are very asymmetric. Go ahead and raise your eyebrows nice and high. She tends to lift a little bit higher in this outer brow. This is very normal, which is why I do recommend people coming back for their 2-week follow-up, because once the Botox is completely set in, that way I know if we need to have any touch-ups or make any corrections for symmetry purpose. I'm just gonna have you turn my way. Go ahead and squeeze your brows together nice and hard. This is usually a 5-point injection. I'm gonna come on this side. I'm gonna go right next to it. It's a little bit more sensitive right there. You're doing so good. I'm gonna come on this side as well. And we're just gonna go right in the center here. And as you can see, very minimal bleeding. She will have a little bit of redness. It will look almost like mosquito bites. That will go completely away in the next 15 to 20 minutes. The next area that we're gonna treat is your forehead. I really like to customize everybody's injection specifically to their muscles, because nobody is exactly the same as the next. So I'm gonna have you raise your eyebrows nice and high for me. Do you like to have a high eyebrow lift?
I do, yeah.
Okay, well we will keep that then. Little sprinkles. And relax. And raise all the way up. Excellent. And we're going to do one more on this side, raise all the way up. And again, this is also not only preventative for her, but to treat her migraines. She tends to get her migraines right across her forehead. We're now going to go ahead and add a little bit around her eyes just to help open her eye a little bit. I'm going to turn your head slightly. Go ahead and give me a really big smile and relax. Excellent. Now for women a little bit older, more my age, we tend to get a little bit of crepiness underneath our eyes. With a trained injector, as we all are here at Synergy, we can actually inject just into those little fine lines, and that will help to soften those right on away. But she doesn't have that, she's good. All right, we're gonna go right around to the other side. Smile for me. all done. We're gonna finish her off by treating her upper lip. She has expressed to me that she would like to receive lip filler in the very near future, but certainly wanted to try out the lip flip just to see if it is something that she does want to move forward with. She received the lip flip last time and really liked it. And a lot of times when I also inject filler to the lips, I will also add a little bit of Botox to that upper lip. The combination is really optimal. It is a little bit more sensitive to the lip. But as you can see, it's not terrible. All right, I'm just gonna come right on around. We'll finish you off. Excellent. And that's it. That is pretty much a full face treatment. As you can see, in very short time, she bled just very little, but it stopped. Already the red bumps are going completely away. After treatment, what I'm going to do is apply a topical serum that works in relation and in conjunction with the Botox. It's called Revox, and it will have arnica in it that will heal any bruising that may occur, which I don't think she will have any at all. It will also promote tissue healing. It is a topical neurotoxin, so it works really well with the Botox as far as longevity goes. And you did absolutely wonderful. How was it?
It's pretty painless, actually.
Good. So no exercise today? No laying flat for 3 to 4 hours. I'm gonna see you back in 2 weeks, and if you have any questions, I want you to give me a call, okay? All right. Well, thanks for joining us, guys. I look forward to seeing you. Thank you for attending my session. For additional information, go to my speaker bio and click Request Follow-Up. If you're ready to purchase, head over to Shop to purchase Botox as low as $9 a unit, and be sure to enter the code BotoxRocks to receive 500 points.